All right, good afternoon, everybody. Thanks for joining us on this afternoon's webinar, Building Better Health Through Improved Housing Codes, Proactive Inspections, and Effective Enforcement. Here in the final week of National Healthy Homes Month, we're excited to take a deeper dive into the role of codes and code enforcement in creating healthier home environments. First, we'll hear from Amanda Reddy, NCHH's Executive Director. Amanda will be followed by Robert Curry from the City of Dallas. Both Amanda and Bob love to talk about codes, how to make strong codes, how best to enforce them, and how effective codes promote and improve community health. And by the end of the webinar, we hope that you'll be similarly inspired to take action in your own community or share your own story of how housing codes can be used to improve health. Following their presentations, we will open the floor for questions. We ask that you post your questions in the chat box. Can already anticipate one question, so we'd like you to know that today's webinar will be recorded and the recording and slides will be posted to our website. Finally, as we get underway, we ask that you mute your phone lines to minimize background noise during the presentations. With that, I'll hand it over to Amanda Reddy to get us started.
Thank you, Chris, and good afternoon, everyone. Thank you so much for joining us to talk about this topic that we are so passionate about here at the National Center for Healthy Housing. But before we dive into the role that housing codes and code enforcement can play in improving asthma, lead poisoning, injury, and other health outcomes, it may be worthwhile to take a step back and set the context for why and how housing matters for health, and just as importantly, how housing can be part of the solution for some of our most pressing and persistent public health problems. I think as many of you on this webinar already know, Americans spend a majority of their time indoors, and a significant portion of that, about 70%, as estimated by the National Human Activity Patterns Survey, is spent at home. It's worth noting that this number can be even higher for more vulnerable populations like very young children, the elderly, some disabled residents, which means that the home environment is one of the most important settings for setting the stage for health and well-being. And so if we're all agreed that housing matters for health, and I'm guessing that if you're on a distribution list that let you know that this webinar was happening, that you're already well convinced of that fact, the natural question to follow is how does it matter? And of course, we know that the relationship between housing and health is multifaceted, and that the location, affordability, the surrounding neighborhood can all impact health in a variety of different ways. However, here at NCHH, we're most often concerned with how housing quality can affect physical health, mental health outcomes, safety, and well-being. So we're really focused on that quality dimension of how housing affects health and how it interacts with all of these other different dimensions of housing. Diving deeper into how housing quality affects health, there are a number of hazards that may be present in the home environment and that have the potential to impact the health of the people who live there. These can include chemical hazards like lead or radon, biological hazards like mold or dander from pests or furry pets in the home, and physical hazards like structural issues that could lead to falls or injuries. And we know that disparities in housing quality and in these housing conditions can exacerbate disparities in a variety of different health conditions linked to these environmental exposures. For instance, housing that is full of mold and cockroaches can make it really impossible for someone to control their asthma, even if they're doing everything else right. It can just make it really hard to control their condition. We know that housing affects not just asthma, allergies, and other respiratory conditions, but a wide variety of other health outcomes that you see on your screen, including lead poisoning, falls and other types of injuries, cancer, cardiovascular events, poisonings, death, mental health outcomes. And it's also worth noting that quality of life outcomes are affected by housing quality as well, things like school and work attendance or caregiver quality of life. So the natural next question to ask, since we know that housing is important for health and the way in which it matters, is that we know it's a problem, but what can we do about it? And it turns out that that's a really important question to ask. Several years ago, the Frameworks Institute examined the public's understanding of housing and housing quality and the relationship to health. And they issued a report that you see referenced on the screen here that had some really important findings. And it's important to note that the public here can be broadly interpreted to include even, decision makers, local, state, national decision makers, funders, other people that those of us on this webinar today are probably very interested in having some awareness brought to this issue. And what they found is that the public is really pretty well aware that there is a connection between housing and health, that people don't need necessarily to be convinced of that fact. What is a problem and where we get stuck in our conversations with decision makers, with funders, with the general public, is that there's a fatalistic attitude. So people understand it's a problem, but they think there's nothing we can do about it. It's just too big of a problem. It costs too much, and we can't fix it. And of course, we know that there are a lot of solutions, cost-effective, practical, real solutions that we can put in place. And so it's important for us to be able to speak about that and to be able to deliver on those promises so that we can overcome that fatalistic attitude and encourage investment in housing to improve population health. And when we're thinking about what we can do about it, just a few slides to give us an overview of some of the wide variety of strategies that are available. This is an image from the Environmental Health Playbook that is put together by the National Environmental Health Partnership Council. I don't expect you to be able to see all the details or study them on the slide. The arrows that are in darker blue here outline critical functions of an effective environmental health system in a community. So things like having a well-trained workforce and sustainable funding, evidence-based policy and programs, cross-sectoral partnerships. You can see the whole list here. Those are critical components of an effective environmental health system within a community. And then within the Environmental Health Playbook, for each chapter that was developed, there were specific strategies related to the specific topic area that were outlined in terms of evidence-based strategies that could be put in place. And from this slide is taken from the housing chapter. So it highlights specific strategies related to improving housing affordability and safety. So it's clear that quite a lot can be done across all of these different domains. And those highlighted in orange on this slide all relate to housing codes and code enforcement. So it bears thinking about why housing codes and code enforcement. This is a large number of strategies that we see are related to these issues in this particular type of systems change within a community. Why is it so impactful? And first of all, I think it's important to say that we know not just from experience or logic, but also from studies like the one referenced on screen. This is Beck et al. Out of Cincinnati, that places where there are higher numbers of housing code violations tend to co-occur with places where the burden of asthma or other housing-related illness is high. So here we see that the density of asthma-related housing code violations, that's represented by black dots on this map on your screen, overlaid with asthma-related emergency department visits by census tract. And we see that the concentrations of black dots are higher, they're denser in those red and purple areas where the burden of asthma-related hospital emergency department visits and hospitalizations are also high. So we definitely know that there is a relationship here between housing codes and health outcomes. So it's worth diving a little bit into how housing codes can be part of the solution. And so we're going to take a minute. I'm going to spend some time on this slide. And this slide looks really simple at first glance. It looks like it's very obvious. These seem like very obvious components of an effective code enforcement system, but it's really worth unpacking each of these different aspects of an effective code enforcement system. These strategies come from a document put together by Change Lab Solutions, and I want to acknowledge them and the excellent work that they've done in this area. National Center for Healthy Housing was one of a number of partners that contributed to this document, and you see the URL, the website link at the bottom of the screen here for accessing the full document, and I encourage you to check it out and all of the companion resources. So the first step in putting together an effective code enforcement system seems somewhat obvious, and that is to start off with a strong housing code. And part of the challenge that we have here for housing code in many communities is that they tend to use ambiguous phrases, words like safe and healthy and decent, that can be left up to individual interpretation by individual inspectors. It's not always clear what is meant by those words. And also, many housing codes don't always properly address health-related threats in the home, such as pests, moisture, ventilation, and chemicals like radon or lead. So there's definitely opportunities to improve the clarity and strength of housing codes in many jurisdictions, even those that have adopted things like the International Property Maintenance Code to clarify and strengthen some of those ambiguous phrases. Obviously, once you have a strong code in place, you need a system to be able to implement the code and ensure that it's enforced. And in order to have that system, you need to have funding in place. State and local law may govern exactly what's possible in this arena, but we commonly see that code enforcement systems are funded through general funds, through permits and licenses and fees, sometimes through fines and penalties that are levied against owners, property owners that have violations and that don't comply with plans to fix the violations. And we also see in some communities supplemental funds coming from places like a community development block grant funds, where you're able to shore up the code enforcement system and workforce development to implement the system. So lots of opportunities to have robust funding in place for these systems. Of course, once you have a system in place, you need a workforce to be able to deliver the system, implement the system. And so you need that workforce to be trained. And this is one that always seems so obvious, right? That obviously these your code enforcement officers need to be trained in all applicable federal, state, and local laws. But it's also really important to make sure that your team is trained in other types of skills, best practices, and some of the softer skills, things like working with landlords and tenants, where to find resources to help residents. That kind of training is sometimes overlooked, but is a really, really critical component of ensuring that you're able to effectively enforce codes within your community. It's also worth considering training more than just the officers that are out in the field. Many times there might be staff that are receiving phone calls or overseeing those officers, people who interact with the system in some way that may also require training to be able to do their jobs more effectively. So we really encourage you to think beyond just training people in the codes themselves, but really thinking more broadly about how to help them do their job and work with residents and property owners most effectively. It also requires partnering with community-based organizations and other agencies within the community. Community organizations can be really critical in doing things like educating both landlords and tenants about their rights and responsibilities and about the code enforcement process. But they can also provide needed supplementary services, things like referring people to the code enforcement system, connections to mental health and social service programs. If your code enforcement officers are going into a home and they encounter a situation that needs to be addressed, having community-based partners who can help make those connections can be really critical. Help with language and cultural barriers, and then sometimes even providing connections to help property owners who want to do the right thing get help to make those repairs. And similarly, those cross-sector and cross-agency relationships are really vital. In some communities, responsibilities may be spread across multiple agencies, which make the process confusing for tenants and for landlords. And in many cases can lead to duplication of services and just be really frustrating for residents, or even worse, it can lead to nobody taking responsibility, everybody assuming that somebody else is overseeing that and taking the lead there. And so it can be really important to have those cross agency relationships to help streamline the process. An example that I love to highlight here of something really simple that can be put in place is that in Erie County, New York, where the city of Buffalo is, that the the county health department inspectors who work in the county's lead and healthy homes programs are deputized code enforcement officers. So when they go into a home and they see code violations, they are able to cite the code violation right then and there as part of that lead investigation or that healthy homes investigation, instead of referring the case to code enforcement. So that streamlines the process for all parties, a really simple way to achieve that cross-agency collaboration and improve outcomes for everybody. And so those are the first 4 bullets on this slide. Moving into some of the even more challenging stuff now is a concept number 5 of and number 6, sorry, of cooperative compliance and promoting a cooperative compliance model. This is really about transforming the traditional us versus them dynamic in code enforcement transactions and equipping your code enforcement team with tools to work with and support property owners throughout the process, from helping them understand why it's important to fix the violations that have been cited, to how it can be fixed, getting them connected to resources. So really working with them in a proactive, supportive way, as much as possible, instead of just coming in, from a punitive angle right away. But of course, sometimes, that's only going to get you so far, and that there will be times when more stringent enforcement actions will be needed. And so you need to make sure that there is a strong enforcement mechanism in place. Enforcement actions tend to fall into 3 main categories in most communities. The most common of these are administrative actions. These include things like written notices and fines, departmental hearings, liens put on the property. So those are the most common types of actions to compel property owners to make the necessary repairs. There are also options that can be put in place in some community, including civil enforcement actions, working through the court system to compel the property owner to make repairs or pay additional fines or damages for the violation. And in some states, you may even be allowed to have criminal charges for some types of violations. These are usually a misdemeanor or an infraction, and it's worth noting that these court options are much more costly and usually used as a last resort. And if you put in place an effective system that has all of these extra supports that we're talking about today, the times when you would even need to be considering that level of action should be very few and far between. That there shouldn't be so many cases that escalate to that level. When we get to number 8 and talking about a proactive rental inspection program, this is really sort of the gold standard of where you can put together a really impactful best practice code enforcement system and really have the maximum impact on population health. Traditional code enforcement systems are complaint-based. So, a tenant who, or a neighbor, somebody who sees a violation, calls and complains, and then code enforcement officers come out to investigate based on that complaint. Under a proactive rental inspection process, all of the units are inspected on a periodic basis. And this doesn't replace a complaint-based system. Those things run side by side. But it can be really, really important in helping vulnerable populations access the benefits of a code enforcement system and providing just more equity within the system in general. For instance, you can imagine renters, undocumented residents, others who may be unaware of their rights or afraid to exercise them, would benefit from having a proactive rental inspection process, because under a complaint-based process, they may be afraid of repercussions from a landlord if they make a complaint. So the proactive rental inspection process can really help there to make sure that they're benefiting from the standards that are put into place. A proactive rental inspection process has 3 major components. There's a registration component where either a certificate or license is issued to a property. There are periodic inspections. These tend to be every few years. We see 2 years, every 2 years to every 5 years in most programs. So it varies from community to community, and then enforcement for those who fail to meet the standards. It's also important, regardless of what kind of system that you have in place in your community, to really think about supplementary programs that are needed. And we talked about this a little when we talked about partnering with community organizations, but really that importance of having educational programs so that tenants and landlords both understand their rights and their responsibilities, that they understand the process. As well as having programs in place, whether through community-based organizations or through a municipality itself, to allow residents to access resources to either subsidize or pay for repairs, things like low or no interest loan programs for example, to make sure that property owners that want to do the right thing but may be struggling themselves have some supports in place to be able to do the right thing. Relocation assistance is another example of a supplementary program that can really smooth the way for allowing property owners to do the right thing but make sure that residents are protected through the process. And then finally, it's really important to make sure that we are constantly evaluating the code enforcement program too. This helps us to monitor the functioning of the program, to know what's working, what to improve, to help you make the case about why you need, the resources that you have, or you need increased resources within your community to be able to provide a number of services. And, this is also a place where the way that you set up your evaluation can help you really take your game to the next level. So you can not just look at things like the number and types of complaints received, that sort of thing, but you can look at your metrics related to things like the number of units that are brought into compliance within a certain time frame, or the average time frame it takes to bring units into compliance. And if you start doing that and looking at it by neighborhood or by census tract or census block, whatever geographic unit that your data allows you to look at, that can also help you identify gaps in your services. If you have a particular area of your community that doesn't seem to be accessing services, or where complaints are taking a long time to get resolved, it allows you to go in and take a look at what's happening in that community and find out what it is that's needed to be put into place to increase and improve the quality of services there, whether it's additional language services that are needed, or whatever else is needed to bring that up to the same level of performance as the rest of your system. I also just want to conclude here now by sharing a few tools that can help you get started on some of these early steps. So the first step we talked about on the last slide was establishing a strong housing code. And the National Healthy Housing Standard was developed by the American Public Health Association and the National Center for Healthy Housing back in 2014, along with a large panel of experts from around the country. And what this is a set of performance standards for existing housing. It's divided into 7 sections and 38 subsections, crossing a variety of different housing conditions. And the idea here is really to bring public health rationale into housing code parlance, so to basically serve as a model code for existing housing. It includes, within those 7 sections and 38 subsections, both core and stretch provisions. So core provisions are sort of the basics that we believe should be in place to really have a housing code that is very protective of public health. The stretch provisions are really taking it to the next level and being, going above and beyond to protect resident health. And the National Healthy Housing Standard can be used as a model code. A lot of communities have found that it is been helpful to look at the National Healthy Housing Standard and compare it to their own local code to be able to see where they have opportunities for improvement. Right following the release of the standard, the National Center for Healthy Housing worked with about 25 different jurisdictions to compare their code to the National Healthy Housing Standard, and generated charts like the one you see on their screen, where their local code would be shown by the blue bars, compared against the International Property Maintenance Code, showed by the dotted red line. We know that that's the code that is adopted by many communities around the country. The core or mandatory provisions of the National Healthy Housing Standard are shown in the purple bar, and then if you were perfect across the board and the percentage of provisions that you had, that's represented by the green line. That's all of the core plus stretch provisions in the National Healthy Housing Standards. And so what this would allow a community to do is really zero in on the places where they wanted to improve their code, where their code was weakest, or where they had the greatest opportunity to improve their local code and strengthen it to protect health. And in fact, we've seen two of those communities that we worked with do some work to take that baseline comparison and take action to strengthen their housing code. So one of those, there are two case studies. You see the link on your screen here, came out of Tukwila in the state of Washington. Back in 2015, the Tukwila City Council adopted ordinance number 2481 that incorporated the National Healthy Housing Standard wholesale into their local property maintenance code. So they just decided to use the model code and build from there to be able to strengthen their housing code. I won't say too much about the city of Dallas because you're going to hear that story from Bob, but they went above and beyond. They started with a focus to update their local property code, really focusing on first on issues related to respiratory conditions, but rather than just be satisfied with strengthening their housing code, they also decided to go the extra step to put in a proactive rental inspection process in place at the same time. And you're going to hear more about that story shortly. And if that's something you're interested in doing in your community, I am very pleased to announce that we have available now our code comparison tool. Our Deputy Director, Jonathan Wilson, likes to call this TurboTax for housing codes. And what this allows you to do is, instead of waiting for a group like NCHH to do that comparison of your local housing code to the Healthy Housing Standard for you, it gives you some guidance about what types of documents to gather so that you can compare your own local code to the National Healthy Housing Standard. And what will be generated then is for each of those sections, you'll get a report that tells you how your community rates compared to the National Healthy Housing Standard overall, and it will also highlight for you each of the provisions that already exist in your local code and provisions that your local code does not include that you could consider incorporating into your code. So you'll get that customized report automatically after filling out the sections. And it's worth noting that the sections can be completed individually. So if your community is only interested in codes related to moisture control or pest management, you can pick and choose the sections that are most of interest to you. I want to conclude by sharing, just in reflecting and acknowledging that there are some common challenges that we run into when we talk about implementing and improving codes and code enforcement systems in a community. And you see many of these outlined on your screen here, including a lack of data. Financing is a big one, just figuring out how to have enough money to stand up something like this. Many communities we hear we've got a complaint-based system, and with the 2 officers we have, they can barely keep up with the caseload. So these other things seem nice, but we don't know how we would even manage an additional caseload of a proactive rental inspection program. So it's really, really key to understand that other communities have been able to figure this out and find ways to finance additional workforce development, again, whether through community development block grant or other types of partnerships in their community, to be able to make the case that this kind of expansion and investment is worthwhile. Poor enforcement mechanisms is probably at the top of the list of barriers that we hear from communities that just doesn't exist in their community. And one of the things, that can be something that can be difficult to change, but I really like to emphasize is that if we go back a few slides, that's where that focus on some of those other types of elements of a code enforcement system, things like educational programs, partnering with community-based organizations, streamlining processes between agencies, having supplementary programs that help property owners do the right thing can really help, because what it'll do is reduce the number of properties that have to go through an enforcement process. If you can really make it as easy as possible for residents to work with you, and you reduce the number of people that have to go through the enforcement mechanisms, that's really ideal all around, and it lessens the the problem that you might have if you have poor enforcement mechanisms in your community. We hear a lot also about a fear of opposition from landlord or other groups in a community, or their perceived costs of improving housing quality, as well as unintended consequences. If we put this in place, will landlords just take all of their units off the market, and then you leave people with no housing options? And those are certainly real concerns, and we have lessons learned from communities and how they, in many cases, some of the opposition they were fearing doesn't come to pass. In other cases, again, having some of those established partnerships can help you mitigate the impact of those unintended consequences. And Bob, I think in his remarks, will tell you about, for instance, in Dallas, how some of the partnerships they had in place helped them to face these challenges and navigate their way through this and still do the right thing to strengthen the system to improve housing quality in their community. And I hope, if I've left you with any thing today, it's that, that this is possible, that despite these common challenges, that there are lots of folks who have figured out how to do this. You see some additional tools on your screen. I mentioned our partners at ChangeLab Solutions and the excellent resources that they have there. I want to also point out that at the National Center for Healthy Housing, we have an entire web page devoted to housing code tools. That's where you'll find the code comparison tool, the National Healthy Housing Standard, but also a wealth of other really important tools and resources that may be of use to you. We also have places where you can look for model policies or ask for technical assistance or coaching if this is something you're interested in doing in your community. So I want to make sure we have time to hand it over to Bob. So thanks, everyone. I look forward to the Q&A at the end of the session.
Okay, this is Bob Curry. Can you hear me? I hope.
Yep, we can hear you, Bob.
Okay, thanks. My name is Bob Curry. I work for the city of Dallas. I worked for 15 years in the code department here. And just to kind of relate it to how code things are organized, in many cities, building inspection or some other department will actually run the code enforcement program. In our city, fortunately, we don't. It is a standalone department. It's funded out of the general fund, has been for years. And so we have been always looking for ways to improve it. Along with police, code is probably one of the most visible high visible departments in the city. When you listen to what citizens complain about, it's either police response or code enforcement. And the basic distinction between the two, I'm going to go down here to the next slide, if you would, please. There's really two big areas of regulation. One is what building codes do, and that's always related to the new construction or remodeling of structures. In our city, like many, it comes from the International Code Council, and we adopt those provisions of the code that apply to us. And there have been a number of different codes over the years, but ICC is now the main one. And it's based on experience that happens when buildings have problems and they look at the issue, solve it, and put it into a code so that it will not occur again. The other one that we focused on in Dallas is the maintenance of structures. So it's one thing to put a building up, and then what it starts to do right away is depreciate and go downhill as a result of people living in it or using it or other forms of physical deterioration. So our housing code, which we internally call Chapter 27, regulates the maintenance of the structure, what's going to be maintained and how it's going to be maintained to what standards. And the common ones are four. One is just the deterioration of the structure. If you've ever been in a city someplace, I'm sure you have, you'll see a building, maybe a wood frame house, been sitting there for 5 or 10 years, and it looks worse for the wear. the paint's fallen off, the windows are broken, and so forth. The other one that is pretty common is plumbing, the leaks that come from water. It can also include roofing, but plumbing leaks are a huge problem and one of the more frequent complaints we get in the city. Related to water leaking is mold, because it takes warm temperatures and moisture to create the conditions for mold. Mold, as many of you know, is a common allergen. So we have to deal with that in some way. The other two that are common are insect infestations. In Texas, we have a lot of things called cockroaches. I know you have in other parts of the country as well, but we have that. We have bed bugs, and all of those kind of, there we go, all those kinds of conditions that happen where people live. And finally, there's safety, whether it's smoke detectors, CO2 detectors, rugs that are loose and have tears in them that people could trip and fall on. All of those things are the common things that we deal with in the maintenance code. A common maintenance code is the International Property Maintenance Code, and it's pretty good as a start. A lot of smaller cities use that because they haven't gotten around to doing their own code as we have. And it's a good way to start. You can just almost click on it and then adopt it to your community. And I also recommend, even if you do that, to compare it to the National Center for Healthy Housing codes and see where it compares. So those are where codes come from and kind of where you get them. How you adopt them into your city can vary a little bit. So next slide, please. Okay. In Dallas, like many codes, there's a triggering incident or set of conditions that tend to bring things forward. And in Dallas, there's a children's hospital here that is really committed to the health and wellness of kids, and they track hospital admission data around the area and found out in 2013 that we had a spike in ER admissions for asthma. Well, you look at where those people come from, it's very much like the maps that Amanda was showing you. There's a very strong positive correlation between kind of the affluence of the area and sometimes the racial mix of the area and asthma triggers. It's generally, in our town, the poor population tends to live in old structures. Old structures, by their nature, were not built to modern specifications and have degraded over the years in any case. So we knew that we had a problem, and it was pretty well documented. So we started in 2014, kind of based on that data and on their advocacy, to pull together the forces within the city that could make a positive impact. So the Code Compliance Department and the City Attorney's Department began to review the codes. And in our city, one special section of the city attorney is what we call community prosecution. It's kind of an unusual group of attorneys that are embedded in neighborhoods and kind of advocate on the behalf of the citizens that live there. So we got all these forces together, and one of the guys that was in code, who also worked for the attorneys, went through our code and just said, these are the parts of it that don't work. And so that was more of a pragmatic, trying to fix the problems that we knew we had. But then, fortunately, one of the people in Children's Hospital said, you know, you really need to look at the National Center for Healthy Housing. They've developed some standards that might be able to help you out. And we did. And I think it started with a phone call, It may have been with Amanda. I don't remember, frankly. But we got National Center for Healthy Housing to look at our code because their standards had not been all assembled at that point. And they came through with a lot of really good input. And frankly, without their input and expertise, we wouldn't be where we are today. Once we began to codify the things that we thought we wanted to change that would make a difference in healthfulness and in the other issues that we had, we went through a pretty lengthy process of what we call stakeholder inputs, meeting members of the community, meeting doctors, anybody that had their finger on this, and eventually going to the city council with a series of committee briefings and the council itself. And finally, after a couple of years, the council passed on September 28th to 16 our revised maintenance code that went into effect on January 1st to 17. So next slide. So we had a lot of major partners in this. And as Amanda had mentioned, the collaboration in this makes a huge difference. Obviously, we had the Children's Medical Center, Metrotex Realtors, which is the real estate agents in town that manage a lot of properties. Center for Community Progress, Dallas Area Interfaith, a advocacy organization here, which is kind of an offshoot of some social advocacy out of Chicago, really represented tenants quite well. Texas Tenants Union spoke on their behalf. The Apartment Association, because in Dallas, a lot of people didn't realize this. 60% of our population lives in a rental facility. 40% of them in apartments or condominiums, and 20% in single family. So the majority of our population is touched by living in rental property. So, and of course, the unifying force in all that, frankly, was National Center for Healthy Housing, who spoke with us on numerous occasions. We met with them and so forth. But it took this collaboration of data and opinions to get it moved forward. So next slide, please. In the Children's Medical Center, and you'll see this slide is very similar to the one Amanda was using. The focus is, in this case, is on pediatric asthma. 60,000 children are affected by it in our city at a cost of $60 million a year. That's a whole bunch of money. And it's based on emergency room trips and hospitalization. And you can see from this map, the higher incidence is in the darker red color. And if you overlay this map to the population demographics and the income data, you'll see that big blob kind of right in the middle is an area of pretty bad housing. And also coincidentally, is largely people of color. So we knew we had a problem. We knew it affected specific locations and demographic groups. Next slide, please. So the major changes that we put in our ordinance were, in addition to some health provisions, we chose to make a change in rental property regulation. We had for many years a proactive registration and inspection program of multi-tenant properties. But when we started looking at our data in preparation for this examination, we found we had another 20% or 50,000 families that were living in rental properties which had never been looked at. And in our city, I think maybe like many, the lack of regulation of single-family rentals really led to what we politely call slumlords, people that have aggregated for business reasons anywhere from 2, 10, up to 500 properties. And they run them like a business, and without any oversight, some of them have less than the most pristine values. So in our regulation, all of the property maintenance conditions that apply to all of the housing where everybody lives, whether rental or not, now got applied to single family. We chose to have a proactive inspection program once every 5 years, but we can certainly respond to complaints and do. But having those programs where the owners know we're going to be entering their property has really begun to make a difference. Now, some people said, oh gosh, as Amanda said, people are just going to leave wholesale and it'll just exacerbate the affordable housing problem. That hasn't proven to be true. It has been true in some isolated cases. I've had people call me and say, I've got a couple of 40, 50-year-old properties. It's going to cost me $40,000, $50,000 to update them, and it won't really be economic for a rental. And they chose to maybe sell them to someone, many times the person living there. So I don't have any data to support that, frankly. But the fact that the people did not leave it on a wholesale basis has just not proved to be true. So I would suggest if you're going to do property regulation, use the National Center for Healthy Housing, and we compared ours to those standards and found out we had holes. And in fact, after we even passed the ordinance, we still have holes. But it's not a quick fix. So here's the major changes we made to impact healthfulness. In Dallas, it gets very hot here. It was 110 air temperature here a couple of days ago, and we had a pretty hard to manage temperature regulation on indoor temperatures, and it had to do with the time of the year, and it just didn't work real well. So what we ended up doing, instead of just a temperature regulation in the summer, it's year-round. Can't be over 85 degrees inside. And there was some grumbling about that, especially apartment owners that had antique chiller systems, because it takes 2 or 3 days for that type of system to normalize the temperature. And sometimes we have 95 degrees one day here and 65 the next. So it's a difficult management problem. But fortunately, everybody's figured out a way to address the thing. The second thing we did, this is very subtle. Historically, if a landlord owned a bunch of property and they had bugs in the house, they would get their janitor or maintenance man or carpenter or handyman or whoever it was and send them off to a box store or some other place, buy whatever was on sale for treating bugs, and just go into the house and throw it all over the place with no real sensitivity to who was living there or potential allergenic conditions. But so all we did is make one change and said, if you're going to treat pests in that property, it must be done by a licensed pest control operator. Huge change. We thought we'd get yells and screams about it because of the cost, and we got none. But that was a big change. The third thing we did was to make provisions to address the source of mold. I don't know anybody in the country that really wants to regulate mold by itself. But what we did was look at the indoor air quality aspect of that. If you've got older properties in your rental community and you have windows in it that used to slide up and down, maybe with weights, those windows have most likely been painted shut for decades. That certainly was true here. So we just said, look, if you've got a window in your rental unit or in your property that is designed to open, it has to open. So we've had a lot of people going around and stripping the paint off of those windows so that they can open and people can have at least fresh air in their property if they choose to. Kind of related to that, but not quite as dramatic. Those fans that people put in bathrooms that are supposed to vent, we made sure that, number one, they have to operate. You have to turn them on, the motor has to run and blow the air. And number two, it has to vent to the exterior. Now, that's all part of the building codes, but a lot of times that hasn't been maintained over the years. So those few things right there improve the indoor air quality, decrease the mold, and certainly manage the temperature from a comfort point of view. So next slide, please. The important part of this, the technical part, was fairly easy. As I've said, National Center for Healthy Housing really paved the way for us in that. But you got to sell this. And we did over 30 community meetings over the course of a year. And that's a lot. And we did 6 briefings to the Council Housing Committee. Those are kind of like the grilling. You go in and sit in front of the Council Committee and they drill you on the stuff. We did 1 briefing to the full City Council. They then wanted a public hearing, which we did. Largest attended public hearings ever been happening in Dallas. There were like 400 people show up, and we had other people tuning in by electronic means. We met individually with all the council members, and every place that we went, we encouraged stakeholders to talk or meet with their council members. So a lot of outreach. And then we obviously passed the ordinance that went into effect in 2017, and now we're measuring the results. Now, just one more slide, and I'll just give you a brief update. Here's what we've been doing since November 18, that we've discovered that are challenges. Identifying possible landlords takes a long time, more than we ever imagined. We started with county appraisal data. Now we're adding utility connection data, primarily from water department. So when somebody moves in, we go, oh, you're a rental property, you need to register, and we can then go inspect. Getting the word out is much more difficult than we anticipated. We knew we had about 50,000 or so properties, and as of today, 2 years in, we've got about 17,000 registered and inspected. So it's a very big task. We had set up an online registration procedure, which was modeled after one we saw in Seattle, but it's just been proven to be too complicated for many people. Maybe they're older, they don't have a computer, whatever. It's difficult. And the property inspections require training of the inspectors, which we expected, or to use a third-party inspector. We've chosen not to do third-party, but we carved out a team of existing inspectors and devoted them to this thing, and it's basically been cost neutral. So that's how we got where we are, and I will sign off, and if you have any questions, you can either address them now or at any time, of course, get the National Center for Healthy Housing, and we'll get an answer. That's it for me.
All right, thanks very much to Bob and to Amanda for the presentations. The forum's open for questions if there are any. I don't see any so far. Maybe all of our questions have been answered. Maybe there's so much to think about. But let's give it a couple minutes and see if any questions come through for Amanda or Bob.
While people are thinking about their questions, Chris, I want to share one story out of Dallas that is featured in that Dallas case study that Bob didn't have time to cover in his remarks, but I think that underscores that point about the partnerships. Bob was sharing that they didn't really have as much pushback or opposition for people just taking their units off the market in response to these changes. And Bob, you can jump in here, but I think if I remember correctly, right when the changes were announced, you did have a major landlord in the city who threatened to take a huge number of units off the market, maybe something like 400 units or something. And it was going to be in the middle of the school year, it would really disrupt families and displace children potentially right in the middle of the school year. And I think through your partnerships, you were able to first talk to the landlord and, convince him to maybe not take as many units off the market or to delay taking some of the units off during the school year to minimize the disruption to the families, as well as work with some of your faith-based partners to help the families use that additional time to find other housing. And so, again, I think that just to really underscore that point of, doing that hard work upfront to build those partnerships, have those supplementary programs in place in your community, whether they're directly through your municipality or run by the community partners, can really help you navigate any bumps in the road that do come up.
Well, it's even better than that, Amanda. What this particular individual did that you're referencing actually became a hero. He understood the problem, worked with the people that were living there. He sold 100 or 150 of his really crummy houses to the people that lived there and helped them finance it. So the people went from being renters to being long-term homeowners in the community, which provided stability. And he's still active over there. He used to be like a swear word. Now he's not. I mean, that was a great possible outcome. And we did all the other things to minimize the disruption of the families and so forth. And we're able to accomplish that in working with them and with a Catholic Charities group. So the people will paint often draconian problems when these things get implemented, but that hasn't been our experience here. So.
Okay, I see.
Really
sorry to interrupt. I see some questions coming through, and I'm going to skip around a little bit because this first question I'm going to ask on behalf of Judy, I think, is related to Amanda's story and Bob's statement here. The question for Bob is, did you find that small individual owners were more likely to register, or was it large property management companies?
Well, numerically, you have more small owners than big ones. So the ones that have registered for the most part have been smaller owners because it's fairly easy. If you've got 100 properties, the registration process becomes a problematic barrier. And that's some of the things we're going to be proposing changes on, but it wasn't the big ones. Some of them registered, but mostly it's been the people that own 1, 2, or 4 in that size.
Okay. A question from Marcos to Bob. How is your program funded?
Well, initially it was funded in general funds because we had to build up the registrations. But the registration now is an annual fee, and it's not quite break even, but almost now. It's never been designed to be a moneymaker, because in our situation here, we aren't allowed to make money on those programs. It's a cost recovery. So it's taken a while to build up. So the city essentially subsidized it for the first few years. And as the more people get registered and it becomes self-sustaining, we will adjust the registration fee to where it's only at a cost recovery basis.
Okay. Question from Ken. Ken would like to know what considerations and actions are implemented for asbestos-containing materials.
That only affects us when there's construction, because as you probably know, if you've got asbestos, say in drywall and that kind of thing, as long as you don't disturb it, it's okay. So we don't inspect for the existence of asbestos, but if there's a remodeling going on and a permit has been obtained, we'll regulate it that way.
Okay, thank you. And a question from John. Did you see any noticeable difference in quality of inspections between city and county inspectors and third-party inspectors?
Well, number one, we don't have third-party inspectors, and the only people that are inspecting residential properties in the city is either the code inspectors or the building inspectors, and they're really inspecting different things. The code inspectors, as we described in this talk, are inspecting maintenance codes, and building inspectors are not. But we have, so there really isn't a direct comparison, but another movement that's beginning to take place here, we have some code inspectors that are now getting ICC certified in property maintenance. And that's a common way of progressing in many parts of the country, but it hasn't been in Dallas. So one of the new assistant city managers that we hired, who worked in San Antonio, was a big advocate of the ICC certification. And what that does is it closes the gap to some degree between the building inspectors and the code inspectors. So we haven't had that problem. We have a minor problem when it comes to Section 8 housing, because you know, the main thing there is that the people who are doing Section 8 housing don't want to be inspected twice. So we have a working agreement where we allow the Section 8 inspectors to be the only inspector on that property. You can argue that's good or bad, but it really eliminates the potential conflicts. So I hope that gives you an answer.
Thank you.
Chris, this is Amanda. I just wanted to jump in and get myself off mute fast enough for the last question about asbestos. If you go to the link for the National Healthy Housing Standard, Section 7.3 of the standard addresses asbestos. So there are model codes there related to the maintenance of asbestos-containing material, the workforce that has to be used to, the trained workforce for asbestos abatement, as well as the actual abatement process and disposal of materials. So that is addressed in the National Healthy Housing Standard, Section 7.3.
Great, thank you. Thanks.
Thank you, Amanda. Question from Karen. Bob, what types of evaluations are you planning to undertake for your program in Dallas?
Well, one of them is we're interested in the rate of asthma admissions, and we've noticed that it has been decreasing as we have improved the program. We've also seen an additional in-home asthma programs that some of the hospitals here have initiated, and that seems to be helpful. We will be looking at our maintenance codes again, now that we've had them out there a couple of years, and seeing how we can improve them in the future. I remember one of the things that we looked at initially and didn't implement was when you're using chemicals in a property, to be able to advise the tenants there of the chemicals that were used and the concentrations. And that, I'd like to move us in that direction going forward. And we're gonna basically take the code and go back now that National Center for Healthy Housing has completed their code and reevaluate it and see what we can do to improve it.
Great. So we're a little bit over time. I'm going to ask one final question. This is Peter's question. How are health outcomes being assessed post-code implementation in Dallas?
Well, the one is what I just said about the hospital admissions. The other one is we're looking at the rate of complaints for things like mold and things like that. And we're finding that we're getting fewer of those kinds of complaints now as people understand it, both on the landlord side and the tenant side. So, but I can't tell you right now because we haven't brought that up to date this year, what's happening. I know anecdotally it's going down, so that's a good thing.
All right, that's great. So we have a couple of questions that came through that we didn't get time for. We'll try to circle back around to Carlos and Lawrence, Estelle and Elizabeth, and get your answers to you as soon as we can. But we're going to conclude the webinar now, and we're going to thank Bob and Amanda for their time and all of you for your time participating today. So we're delighted that there's so much interest in this topic, and we thank all of you for attending today and for the engaging discussion. As I said, we will follow up with resources and answers to the questions along with the recording and copy of the slides. All of those materials will be posted online, and everyone who signed up for today's webinar will be notified by email when the resources are available. This concludes today's webinar. Thanks very much.
Thank you.